My name is Mark Day, Oklahoma City resident, independent business guy. Worked in the oil business for the last 40 years. Hit about age 55 and started having trouble with my prostate. Had problems being able to go to the restroom. It started off not too bad, but I got to noticing I had to go to the bathroom more and more, maybe once an hour, and then got to be once every 30 minutes. And like I say, it was a progressive thing. I think that's a thing a lot of people don't understand, that it doesn't get better. Mm-hmm. And that's what I kept expecting, things to get better, but it doesn't get better, it gets worse. So about 2 years into it, my urologist prescribed Flomax, 1 pill a day. That worked good until I hit about 60. I quit working, wake up at night, had to go to the bathroom but couldn't. So at the age of 62, I was on 2 pills, waking up sometimes 2-3 times a night to a maximum of 5-6 times a night every hour, having to go to the restroom. Had terrible urgency problems, plagued with, like I say, you plan your life around making sure there's a bathroom close. Having trouble traveling. Anytime you travel, you're stopping all the time. Used to be my wife had to stop, now it was me. The last time I went to the urologist, he said, we're going to have to do something with you. And actually, it was a physician's assistant that was there. She said, you're going to need to do a urolift. Researched that, got on the internet, looked at everything, got at what basically that's a bungee cord on your prostate. And, read a lot of blogs about people that had that done, and I read it was not a good result. Might help it at first, but once again it continued to get worse as time went on. And it's another procedure they suggested was TURP, but I talked to some people that had that done and they weren't overly fond of it. It was very invasive, and a lot of times the results weren't what was expected. On the internet, and actually stumbled across the PAE treatment, and read some blogs about South America and about Australia and how it's been in the country for about 5 years. Searched it in Oklahoma, and Blake Parsons came up as the only guy in Oklahoma that can do it, so I called. I signed up on the internet for a consultation, and was shocked. Within a week I got a call back, an appointment, and had the consultation, went in, basically was told the same thing I've been told by several urologists. I have a very large prostate, wasn't draining my bladder. So we decided to go ahead and have the surgery. Afterwards, I had no pain, went home that day, felt a little discomfort. Somebody asked me, well, what do you mean by discomfort? It kind of felt like you had a biopsy for about a day and a half. And after that, I had absolutely nothing. Within a week, started noticing very positive things as far as not having to go to the bathroom, not having the urgency problems. I quit the Flomax within 10 days of having the surgery with no problem. I mean, I didn't miss it at all. It's been 5 weeks now. Mentally, I'm still trying to get over the fact that, you plan your life around making sure there's a bathroom around when you have that problem. I'm serious. Every time you go somewhere, you're thinking, man, I better go to the restroom before I go, or when you get there, you're trying to figure out where a restroom is. Well, now that's not the case. I don't have that problem. I get up, wake up maybe twice a night, not because I have to go to the bathroom, just because I wake up. A lot of times I get up and go ahead and go to the bathroom. This week I was in Taos, New Mexico with my wife, getting ready to return to Oklahoma City. We left our place there, went to a restaurant, had a Mexican dinner with some friends that we met, drank 2 glasses of iced tea, got in the car, drove for 3 hours, before I had to stop. So that was a 5-hour period between having to go to the bathroom, which never happened since I was in probably my 50s was the last time I was, early 50s. So a huge deal and huge change. Huge deal with my surgery was a year ago I was playing golf every day. I'd get home from work and go walk 9 holes, kind of my exercise program, play golf. This year, because of my back pain, lower back pain, I was unable to do that. This spring I couldn't play golf. My game was also on top of that, I couldn't swing the golf club. I was hurting every time I swung the golf club. The week after the surgery I played golf with my partner and 2 other guys, and it was a totally new experience. Had the lowest golf score I've had in several years. Beat all the guys I was playing golf with, and I've had no back pain since. I had a urologist tell me, you have lower back pain. I said, yeah, all the time. He said, that's because your prostate's so big, pushing. And so that went away within a week.